What's the difference between sinusitis and a regular cold? Well, here's one. You can get rid of a regular cold by blowing your nose really hard. You can't do that with sinusitis. Here's another. With sinusitis, your whole face is usually swollen. Not just your nose, and the pain is more intense and long-lasting. We're talking days to weeks, not hours. Then there's the mucus. It's thicker and tougher with sinusitis. And if it's left untreated, it can turn into a major infection. Now, both colds and sinusitis are caused by viruses, but sinusitis can also be caused by bacteria. That's why it's important to see a doctor if you have symptoms like a fever, cough, sore throat, and a runny or stuffy nose that lasts for 10 days or longer. The good news is that there are treatments that can help relieve the symptoms of sinusitis. So don't suffer in silence. See a doctor today. What is the most common thing that triggers chronic sinus inflammation? You're not gonna believe this. It's actually not allergies. It's not even close. There are two main things that cause chronic sinus inflammation, and one of them is more common than the other. But first, let me tell you about the most common thing that triggers it. It's a type of fungus that lives in the sinuses of about 3/4 of all people. It's called Aspergillus niger, and when it comes into contact with the lining of your sinuses, it can trigger a massive immune response. This can lead to inflammation and a runny nose, stuffy nose, fatigue, cough, headache, all the symptoms of a sinus infection. The crazy thing is that everyone has this fungus in their sinuses, but not everyone has these symptoms. So what's the difference? It's your immune system. If your immune system is strong, you'll be able to fight off this fungus and prevent it from triggering inflammation. But if your immune system is weak, then you're more likely to have symptoms. Allergies can make you feel like crap, and if it's really bad, it can even lead to something called sinusitis, which is an inflammation of the sinuses. So how does this happen? Well, when you have allergies, your immune system gets overstimulated by things like pollen or dust, and it starts to release histamine. Histamine is a chemical that causes inflammation, and too much of it can cause the blood vessels in your nose to become leaky. This makes it hard for your body to get rid of the excess fluid in your sinuses, leading to a buildup of pressure and pain around your eyes, cheeks, and forehead. But that's not all. The inflammation can also cause the mucous membranes in your sinuses to swell up, making it even harder for the fluid to drain. This can lead to a vicious cycle where the more inflammation you have, the harder it is for the fluid to drain, and the more fluid that builds up, the more inflamed your sinuses become. So if you're dealing with allergies, be sure to take steps to manage it because it could save you from a nasty case of sinusitis. Here are 6 signs that your sinus inflammation is getting worse. If you're one of the millions of people who suffer from sinus issues, then you know how annoying and painful it can be. And it is important to be able to identify whether your symptoms are getting better or if they are getting worse. Because if they're getting worse, you need to do something about it right away. So the first sign is increased pain and pressure in your sinuses. The second sign is that you have a fever. The third sign is that you have a stiff neck. The fourth sign is that you have more nasal secretions. The fifth sign is that you have more fatigue. And the sixth sign is that you have more brain fog. Now, if you have any of these symptoms, it is important to see a doctor right away because it could be a sign that your sinus infection is getting worse. But there are also other things you can do at home to help relieve your symptoms. One of the best things you can do is to increase your intake of vitamin D. Vitamin D has been shown to be effective in reducing inflammation in the sinuses. You can get vitamin D from the sun, but you can also take supplements. The next thing you should do is to start gargling with salt water. Gargling with salt water can help reduce inflammation and get rid of the infection. And finally, you should consider getting a nasal irrigation device. Nasal irrigation devices are very useful for people who suffer from sinus issues. They help to flush out the nasal passages and improve your symptoms. All right, here's how you know if you have sinusitis. If it's acute sinusitis, which is like a cold or an infection, you're gonna have a fever, you're gonna feel like crap, you're gonna be coughing, sneezing, sore throat, runny nose. All the normal things you'd expect with a cold, and usually that lasts for about a week to 10 days. Now, if it's chronic sinusitis, which is more than 12 weeks, you might not have all those symptoms. You might just have a stuffy nose, but it could also be accompanied by fatigue, headache, pain around your eyes or in your upper teeth. Here's the kicker. If it's acute, your face will probably be red and swollen, whereas in chronic sinusitis, your face will not be red, it will be pale. So if it's acute, think viral infection, bacteria. If it's chronic, think allergies or environmental irritants. All right, see you next time. When is sinus pain a sign of something more serious? I'm a doctor, and today I am going to tell you when your sinus pain could be a warning sign that something more serious is going on. You know, we all get sinus infections from time to time, and usually they're caused by allergies or a cold. But did you know that sinus pain can also be a symptom of a rare but serious condition called a frontal lobe abscess? A frontal lobe abscess is a collection of pus that forms in the frontal lobe of the brain, and it's usually caused by bacteria. The most common symptom is a severe headache that can feel like a toothache. Other symptoms include fever, nausea, vomiting, and a stiff neck. If you have these symptoms, please seek medical attention right away. We'll do a CT scan to confirm the diagnosis, and then we'll drain the abscess and give you antibiotics. It is important to note that this is a rare condition, and it is not usually something to worry about. But it is always best to err on the side of caution and get checked out if you have any concerns. So the next time you get a sinus infection, make sure to watch out for these signs. And as always, wash your hands frequently and stay healthy. Should you be seeing a doctor if your sinuses are inflamed? I'm a doctor. And today I am going to talk about when it is time to see a doctor for ongoing sinus inflammation. So, you may be wondering, Doc, my nose is stuffy. My sinuses are inflamed. Should I come see you? Well, if it's a one-off thing and it's not really bothering you that much, probably not. But if it's ongoing and it's becoming a nuisance, definitely see your doctor. What are some of the things that you can do at home to help with sinus inflammation? Well, saline nasal spray or rinse. That's one thing you can do. Another thing you can do is take a hot shower. The steam from the hot shower will help open up your sinuses. If you're seeing a doctor for ongoing sinus inflammation, what tests will they do? Well, most likely they'll do a nasal endoscopy and they'll look in there and see what is going on. They may do a CT scan to get a better view of your sinuses. And if they suspect that you have a deviated septum, they may do an MRI to look for a more definitive diagnosis. For home remedies that will relieve sinus pressure. By the way, the last one, you'll never told one by your doctor. So when you have a sinus infection or allergies, the best thing to do is to increase the amount of salt in your diet. This will help to reduce inflammation and get rid of that stuffy nose. 2. Drink plenty of water. This will help thin the mucus and make it easier to drain. It also helps to flush out the sinuses and prevent infections. 3. Take a hot shower or bath. The steam from the hot water will help open up your sinuses and relieve pressure. You can also add essential oils like eucalyptus or peppermint to a diffuser or humidifier. And Breathe in the steam. This will help soothe your sinuses and promote better sleep. 4. Eat spicy foods. Spicy foods like chili peppers contain capsaicin, which is a natural pain reliever. So next time you're feeling under the weather, reach for the hot sauce. You ever wonder how a sinus infection can affect your sleep and energy? Well, here's the scoop. When you have a sinus infection, your body is fighting off an invasion of viruses or bacteria. And that can make you feel like crap. You might have a stuffy nose, a sore throat, cough, even lose your voice. All of these symptoms can disrupt your sleep. And if you're not getting good sleep, your body can't rest and recharge like it should. That means you'll have less energy during the day to do the things you need to do. You might even feel like you have no energy at all, like you're stuck in a fog. Plus, a sinus infection can make you feel really cold or even feverish. And that can make it hard to fall asleep because your body is trying to fight off an infection while you lay sleeping. So if you have a sinus infection, it's important to get plenty of rest so you can feel better faster. But don't worry, it's only temporary. Most sinus infections clear up on their own within a week or 2. What is sinusitis and why does it happen? It's when the tissue that lines your sinuses becomes inflamed and swollen, which then causes a buildup of pressure in your sinuses. And the most common reason this happens is because of a deviated septum. That is when the cartilage or bone that separates your nostrils is crooked and it is causing one side of your nose to be blocked. This can make it hard to breathe through your nose, and it can cause your other symptoms like a runny or stuffy nose. Other times, it can be caused by allergies or a reaction to a cold or flu. But did you know that the most common type of sinus infection is actually caused by a fungus? It's called Aspergillus, and it's actually a type of mold that grows in damp environments. Now, most people are more susceptible to it if they have a compromised immune system or if they rate taking steroids. But the good news is there's a lot that we can do to prevent it from happening. So make sure to stay tuned for more tips on how to prevent sinus infections.